Good afternoon. This is Gary Mayor Jerome Prince with a daily COVID-19 update for the City of Gary. Today, as you know, we remain under a stay-at-home order from Indiana Governor Eric Holcomb, and my administration continues to attempt to enforce any order that has been put down by the state administration wherever it's necessary. Investigating the nightly curfew on all travel in and out of Gary will help contain the spread of the COVID virus. Other municipalities, such as Michigan City and others, have begun nightly curfews and requiring out-of-state visitors to self-quarantine for 14 days, while commercial lodging and rentals within the city limits will be temporarily suspended. Chicago police have also announced they will begin directly initiating nightly checkpoints, which focus on traveling safely and providing drivers with information on the state of Illinois' stay-at-home order. These steps may seem extreme, but they are absolutely necessary to contain the spread of the COVID-19 virus. Particularly an important practice is that we continue to practice social distancing, especially avoiding in-person gatherings of 10 people or more. Easter Sunday is of particular concern as it poses special challenges, but the Gary Police will take steps to ensure that all gatherings comply with social distancing orders. Important to remember is that COVID-19 virus, especially devastating in African American communities. A combination of access to health care, prior medical conditions, and other factors make us extremely and a little bit more susceptible to becoming infected, I guess I should say, or continuing to facilitate the spread of this virus. In addition, we understand that some businesses that are not considered essential businesses or services are trying to circumvent the order. Let me be clear that our Gary police officers, along with the Lake County Sheriff's Office and the state of Indiana, will attempt to enforce the executive order that was initiated by the governor. We would hope that persons would respond in a reasonable manner and govern yourselves accordingly. Since the last 30 days, this administration has, on a daily basis, updated our residents with all valid, up-to-date, accurate information relative to the spread of the disease. Shortly, Dr. Walker is going to share some updated numbers with you, which further exacerbate the issue, as well as share our perspective that it's essentially important that we do everything we can to help stop the spread of the virus. In addition to that, Dr. Walker will share some helpful tips as to what you can do if, in fact, you believe that you've contracted the virus or you have symptoms, or worst case scenario, you are tested positive. He'll share information as to what your next step should be. Shortly, you'll hear from Dr. Walker. Thank you.
Good afternoon, citizens of Gary. Once again, it's always a pleasure to come before you. First, I think I should start with sharing the current numbers that are that affect us here in the city of Gary, as they relate to Gary, Indiana, and the state of Indiana. In Indiana, we have now tested 3,869 people. Of that, almost 6,000, so 5,943 people have tested positive. And unfortunately, in the state of Indiana, we've had 203 deaths. More locally, Lake County has seen 461 positive cases. And unfortunately, once again, we've had 12 deaths in Lake County. Now, I want to report now in the city of Gary, we're now eclipsed the 100 people positive in the city of Gary. And that has resulted in now 5 deaths in the city of Gary. That's 5 deaths in the city of Gary. And so we take this time to let those families know that we're praying for you and your loss, and we continue to work to try to defeat this virus. I want to give you a couple of updates as it relates to how we're approaching this COVID virus. One, we are working diligently to set up a field hospital in the city of Gary. And in that case, so that we can be prepared if the numbers increase in the city of Gary. Additionally, at the Gary Health Department, we have now obtained some tests and we are first starting off with testing first responders. Hopefully next week we will have enough tests where we can continue, and we will be able to then maybe begin whole-scale testing in the city sometime next week. So that is what we were working towards. I want to address a couple of phone calls that I've gotten. One concerns stores. If you've seen at some stores, you've seen these squares that are on the floor. They're 6 feet apart. We are encouraging all stores to use this system. And we're encouraging the citizens to use this and to stay in those squares, to be 6 feet apart and give people room. So this is part of social distancing so that we can help stop the spread of this virus. Also, I got some calls about the beach. Now look, it is very important that we all get outside and get some sunlight, fresh air. I know it got warmer. But I would like to be able to maintain the beaches to be open so we can enjoy them and people can get fresh air. However, I'm getting lots of reports of people congregating in a way that does not match social distancing. And so I'm imploring everybody to be very, very, very cautious about our distances, because we don't want to have to close the beaches, but that would be something that I would recommend to the mayor if we're not able to keep people apart, okay? So I want to share something very personal as I share to you my recommendations about how we're supposed to go about quarantining. And I'm going to kind of take a page from B-Nut and Eminem. I'm going to let you know that I tested positive for coronavirus. I am asymptomatic. That means I have not had any symptoms. I have not been coughing. I did not have fever. I did not have body aches. I took the test for corona because I had cared for corona-positive patients, okay? So the rules for me was really simple. From the date I took the test, as long as I remained asymptomatic, it's 1 week from the time I took the test that I had to be quarantined. I was quarantined all weekend. I am now allowed to be in the public. I'm allowed to see patients again with a mask and gloves on. I've decided not to see patients again for another week just because this is very new to everybody. So I said, you know what, I want to go 1 more week of quarantine without seeing patients, but I've continued doing the business of being the health commissioner of the city of Gary. Also, I'm going to share something else very personal. I don't think my parents would mind. My parents also tested positive. Now, I honestly don't know. Did I infect my parents because I was asymptomatic? My parents have some comorbidities. They did not have respiratory symptoms, but they did get ill, okay? My dad has completely recovered. My mom now has had unrelated illness, but we don't know. Did it stress her and cause her to become ill? She's currently in the ICU at Methodist Hospital. I'm sharing that with you because I'm asking for your prayers. I'm also sharing that information because I know how rumors get around, and I know that sometimes people share information they're not supposed to share. And so I just want to make sure that I put that out front to everybody so that we know what the rules are and that we abide by those rules, okay? Now, if you are symptomatic and then you test positive for corona, then you are supposed to quarantine yourself for 2 weeks after you are symptom-free. And so we ask you to do that. If you are symptomatic or think you're symptomatic and have not been tested, we ask you to self-quarantine, and then, once again, 2 weeks from the time that you are symptom-free. So that's if you have symptoms. Now, that is different from social distancing. We're asking families to remain apart from each other. That means no go visiting the cousin because we miss them and we want to go. We're trying to separate households, okay? It's really, really, really important that we do that. I have to tell you that during this time of stress, you see the best in people and you see the worst in people, and I've seen both. But I believe in the best of people, and I think that if we work together, that we can make this happen. I want to address something else, that the African-American community has been disproportionately affected by this virus, and I think that has a lot to do with the health disparities in our community and our high amount of comorbidities. But I think that the mayor and I and our entire team have been working really hard to bring resources into the city of Gary so that we can deal with this. And so we continue to encourage our governor, we continue to encourage our president to really look to see that, you know, that the resources are needed in these cities that have these health disparities. I also want to talk about the good that I've seen. So right now I want to talk about a friend of mine. Her name is Cynthia Dabney. And Miss Dabney contacted me and she said, you know what? we have been making masks for babies and pediatric patients, and we've been making gloves. And we obtain the filtration material so that they can be protected. So they've been making little materials like this. So first of all, this is a onesie. I want to hold this up. I want to show this. This is beautiful, right? This is something that they made just for this moment in time, okay? But in addition to that, this is really, really important. This is expensive. They made these masks. These are for babies, once again. This is filtration material. And you can put it on the baby, right? And that way, it helps to protect the baby, because babies can be affected by coronavirus as well. But she didn't stop there. No. This is the goodness we're talking about in good people. She made these little hand booties, right? And these are important because, just like we're telling adults, children have a tendency to touch their face, and that can expose you to infection, right? So we provided all these things, and I have to. First of all, let me just say this: I've been really, really emotional with my parents' illness, seeing people really, really trying to work hard to, as they're working with every family. And the same thing, to see the goodness in people like Ms. Dabney, who's been working to do this for people. She doesn't get anything, she doesn't benefit monetarily for this. She's doing this out of the goodness of her heart. So I'm going to ask her to come up here and just speak about it for a second, because it's a beautiful thing. It touches my heart. And so if you just come up here and speak to it, it'd be greatly appreciated. Thank you.
Hello, I am Cynthia Dabney, founder of First Time Mom. And yes, when I found out that infants, babies, and children were testing positive for the coronavirus, I said to myself, how can I help, more? So I put my sewing expertise to use, and I designed filtration masks for babies, infants, and children. And so that's my way of giving back to the community and to help. Thank you.
And so, in closing, I want to absolutely thank Dr. Walker for sharing the information, as well as some intimate details relative to his personal health. In addition, we want to thank Ms. Dabney, a member of the community who is absolutely being beyond responsible by practicing social distancing herself, but also attempting to contribute to the community in ways that will help keep others safe. And to that, Ms. Dabney, we say thank you. Dr. Walker shared some pretty interesting facts relative to his own health, and I guess this makes an opportune time for me to share what some next steps would be for us. And so, because of my close association with Dr. Walker, I too will be tested today, although I continue to be asymptomatic, as Dr. Walker suggested, and that is I am without symptoms. We've been around each other for at least pretty regularly for the last couple of weeks, and as he suggested, he's been tested and came back positive, but he's out of the isolation period, and the typical suggestion there or the inference for most people is that, well, if that's the case, perhaps I'm okay. And although I feel completely healthy and I have zero symptoms, as we know, that's not always the case. And certainly as an elected official or someone who's in constant contact with many members of the community, or just from a perspective of being responsible, I certainly wouldn't want to be asymptomatic, be a carrier of this virus, and then share it with persons in the community who would be more susceptible to catching it and then succumbing from it. I am going to be tested, and to that extent, very shortly, we'll be able to divulge the results of my test. It's an ongoing battle, folks. We certainly don't have all the answers here, but most of all, we're attempting to be as proactive as we possibly can, but also we want to share as much information with you to help keep all residents safe. Dr. Walker mentioned the situation at the beaches that are occurring. I was on the phone with the police chief today, and within the next 24 hours, we certainly will have a response to persons who aren't governing themselves accordingly. And unfortunately, that results in other persons not being able to access public places to enjoy themselves or exercise. We certainly want to encourage that, but at the same time, we have a larger responsibility, and that is to keep the community at large safe. And to that extent, whatever measures we need to do just that, we absolutely will take. In closing, I just want to say that these continue to be difficult times, but most importantly, I want to stress that the governor's order, the national order, at least for the next couple of weeks, is to stay home and limit all travel to only necessary trips. We should have no gatherings of 10 or more people, and we certainly need to practice all the proper hygiene measures, such as washing your hands and things of that nature. Our older residents are in the group that are most likely to die from the COVID-19 virus. So we want to remind you to please check on your neighbors, loved ones, and family members who are more susceptible to acquiring or being infected by this particular disease. And remember, most of all, as difficult as it is, if we remain patient and try to be as reasonably calm as we possibly can and share the information that you are apprised to with all of those who you come into contact with, then we can do our collective parts to help stop the spread of the coronavirus. Thank you.